Let's go ahead and Kaushi Kanankege. No, she can pronounce it correctly for us. She's going to share her screen and then we're going to roll with it. I'm really interested in this question about modernization of our ag and how that impacts the biosecurity and the movement of these diseases, and thinking about all this local ag and pushing towards local production and things like that. So I'm curious, once we get into the discussion later, to think about, you know, if we do go to more local food production, is this a positive move or a negative move in terms of how we get our food, and especially on the meat side? So Kaushi, why don't you go ahead and hit it?
All right, thank you, Seth, and sorry about the previous. I think I connected through Mari's link, and that's how. Well, anyway, you can hear.
It's our fault. It's our fault. Don't apologize. It's on our end, so no problem.
All right. So my name is Kaushi Kanankege, and I am a veterinary epidemiologist. That means I work with diseases and how diseases spread across the geographical space and across populations. And I'm working with the Center for Animal Health and Food Safety of the College of Veterinary Medicine. And what I'm going to present today is like an overview of global animal health and food safety and what are the major challenges that we face today. I thought I would start with the how COVID-19 actually has impacted the animal industry and trade so far. When Hubei province went on to the lockdown, within 2 to 3 days from that lockdown, they actually lost millions of poultry because the feed coming from outside of that province was banned, because at the end of the day, they were not realizing which were the prioritizing aspects to send to the province. Therefore, that was one of the losses they had related to COVID. And also ASF, as we heard from the morning, has been already impacting China, and it has been further confounded by the COVID. Sorry about this. And then the World Trade Organization and OIE has been the two international organizations that are associated with this trade between countries of animal-related exports. And OIE actually is the, like Marie mentioned earlier, is the equivalent of WHO, the World Health Organization, but this is for animals. And that's only the disease side, but there are many other aspects that is challenging for animal health and also the food safety today, like the production challenges, cost effectiveness, and consumer concerns and the changes in demand, and also antimicrobial resistance, because it's the same antimicrobials that we use for human drugs is the same one that we use for the animals. So there is that concern, because some time ago, veterinary practitioners used to have antimicrobials as a growth promoters, especially for poultry, which is a practice that is not promoted as of now. And also food safety, as in food contamination, again, like E. coli contaminated beef products, for example. Those are major challenges that we have in terms of animal industry. Now, like I said, I am an epidemiologist, so you would hear more about the disease side of the problem. And what you see here is that US has been among the top 4 producers of both swine, poultry, as well as cattle. And these 3 diseases, African swine fever, which is affecting the pig industry, avian influenza, which affected poultry, and Marie mentioned earlier, and in the United States, we had a huge outbreak in 2014 and 2015 of avian influenza. And then foot and mouth disease. Fortunately, we do not have foot and mouth disease since 1929 in the United States, but it's one of the major diseases that's affecting trade between countries when it comes to cattle trade. I'll talk a little bit more about ASF. I know that we have been talking about ASF since the morning, but I do have some slides that I wanted to share with you. So African swine fever, as the name implies, came from Africa. It was initially detected in Kenya in 1909, and since then it has been circulating between Africa and European region. And with the leadership of OIE, they reached a first phase of eradication in year 2000. So it was successfully removed from Spain, Portugal, and France in year 2000 through culling and biosecurity. But unfortunately, it relapsed back in 2007. And since then, the Eastern Europe and Russia has been having this disease, especially due to wild boar population. And the recent outbreak that jumped from EU to China, I think earlier presentations did mention that it could be from Russia that the jump happened. It could also be estimated that risk could also be from EU pork imports to China. And since then, China has been largely impacted by this disease, and more than 40% of its population has been lost. And retail prices in China has been risen since then. And again, soybean imports from the US has reduced, as again that we discussed earlier. But there are some silver linings to this in terms of United States and China relationship. When the avian influenza hit in 2014-2015, China closed borders to the poultry products from the US. But since ASF, China has lifted that ban. So some of the poultry products are now being open to be exported to China from the US due to ASF. So there's pros and cons, but what I want to emphasize is that how connected we are in terms of food between countries. And like Marie mentioned earlier, can we in the United States get the disease to the United States? And the highest risk is estimated to be from passenger luggages. And this paper is estimating the risk. This is an epidemiological model that has been used to estimate the risk of introduction. And China and Hong Kong being one of the two countries in Asia that poses higher risk of the entry through passenger luggage. So every time when we enter the country, we fill this form, and I hope that next time when you fill that, you will think about the risks that are associated with these diseases being introduced, and how that could actually affect a whole country and between countries. And it's not just one country be affected. This is a butterfly effect. It's if one country gets the disease, then the effect actually would be much more multiplied across a lot of other countries, and that's something that we have as a challenge today, because all these diseases and all these other problems that we have in production impacts our challenge of feeding the 9 billion world population in 2050 at an acceptable cost to the planet. So when it comes to production systems and finding answers to these problems, we are good at thinking each problem as separate entity, but we're not seeing the bigger problem as a integrative way of looking at it, not only through agriculture, not only through animal production and health, but as a collective way of addressing a problem. So some of the things that we could do differently is looking at transdisciplinary approaches of co-producing knowledge. So we include both academia as well as non-academia together to come up with a solution and understand the problems at the field level, and also funding, of course, and training and capacity building, another major piece, and also communication between stakeholders and the researchers, as well as communication between sectors, and also use these collaborative approaches, but also see if these are actually impactful. That is kind of the only way that we could bring a solution to this global problem of food sustainability that we are facing today. So to talk a little bit more about the transdisciplinary approach that I discussed earlier, so stakeholders, who are stakeholders? They could be farmers, they could be an organization who is involved in production of agriculture or development of equipment, for example. All these are different stakeholders that would face their own problems at the field level. As academia, we could work with them together to identify the problems at the field level and then come up with several solutions at the academic capacities and bring these questions, bring these answers back to the stakeholders. And this is very much of an iterative process, and it would take time, but these are one of the ways that both agriculture and health science fields are trying to address the practical problems in the field. Now, epidemiology, how does that fit into this whole picture? There are multiple epidemiological methods that has been used to address these questions. For example, the risk assessment that you saw earlier, the risk of introduction of ASF to the United States through passenger luggage, that was an epidemiological method used to assess the risk. Not only that, there's other data-related ways of converting this data into information that could actually inform policy decision-making processes through modeling and time-space analysis, for example. To tell you a little bit more about epidemiological modeling, what you see here is a graph of what we call a population model. So SIR, S is a susceptible. We divide the population, let's say that there is a disease, ASF, coming into a farm. And this farm has a population of susceptible pigs. That means they're not being exposed to the disease before. And there's some infected pigs who has the disease as of now. And they have the potential to transmit this disease to those that are susceptible. And then in the animal world, we tend to remove these animals if they are infected. And that's the models that you see here in the curves are the ones that that we're looking at as in SIR model. The red curve, which is infectious, let's say that that's the R0 of 2. R0, I know these days everybody is hearing this term R0 as the idea of R0 is how many secondary cases that can rise from a primary case. Now, if you're not familiar with this curve, I'm sure you're familiar with this curve so far. This has been going around flattening the curve idea. What you're looking at actually is the curve coming as infectious. If you look at the graph on top, infectious, that is if it was the R0 was 2. And in the healthcare system, to have the capacity, we need to flatten the curve by reducing the number of people contacting each other and transmitting the disease to each other. And that's the whole idea of social distancing. And that is, again, coming from this kind of an epidemiological modeling. And we're using it not only for human cases, we have been using these methods for animal disease and transmission and control as well. That's modeling of individual level or population level modeling. The map that you see here is Thailand, and it's a risk map of Thailand, how dog-mediated human rabies is in Thailand at district level. This is a project that I've been working on, and it's not only looking at the cases, not only looking at human or animal rabies cases, but looking at other risk factors that are posing to increase the risk of rabies. And this kind of modeling approaches are very much applicable to any other disease. For example, here what you see is USDA's protocol. If ASF gets into the United States, there is a protocol that is existing in United States. the USDA is planning on assigning control zones. And if we are to use control zone idea, that is, if there is a certain region that has the disease, this becomes a major risk to be taken care of by the agriculture and livestock departments. But to actually achieve this zone-based controlling of the disease, so many other sectors such as health, environmental sectors, trade, finance, labor, and also transportation, all these sectors play a major role. This is why the integrative approaches are highly needed to control diseases. For example, let's say that there is a feed company distributing the feed to farms. And if we have this kind of a zone-based control of ASF, the feed companies have the responsibility to first distribute their feed to low-risk areas before going into the high-risk area. And if they are in the high-risk area, when they leave the high-risk area, it is highly needed to do these biosecurity measures, like the previous presentation mentioned. So that's the benefit of using epidemiological models to come up with this kind of control plans. But the most important part is give that knowledge to people who actually can implement. And that is through extension, outreach, and training. And the Center of Animal Health and Food Safety has been implementing a couple of these training sessions especially for veterinarians in Latin America as well as in Africa, and some in the United States, especially after the AI outbreak in Minnesota. So what's the take-home message here is that animal diseases, as we discussed for a long time today, is really affecting our food security and trade. And epidemiological tools can be used as a tool of coming up with a solution for this. But actually we need an integrative approaches to achieve this major goal, because we are highly interconnected. With that, I would thank Andres and Jennifer for the content, and Seth and Maciej for inviting. And if you do have questions, I would either take it now or take it later in the Q&A.